Right, hi Paul. This is this is my presentation. So yeah, I'm going to see if I can do it in under 20 minutes, preferably 15, but it'll never be that. And this is the starting point. I'll leave this up, and when I start, which will be now, I'll press the button. I was rather hoping I'd disappear. So I'm going to say I'm here today because I listened to some podcasts a few years ago by this group, and it's Melissa and someone else whose name I'll have to remember. And for those that want to know what I'm on about, then I've already sort of pre-recorded it, and you'll be able to find the slides on a video. So we talk about that later. But this is why I was invited, well, I brought myself, and to talk on promoting public prevention in oral health, 3Ps. But we now know it's just promoting public prevention in health because they're so intertwined. And this is stealing something really from Marion Nestle, who's a nutritionist, and from her book on soda politics. So this was in the news, and so the Economist is a well-known magazine, and basically what it's showing here is that oral disease, chronic oral disease, are the most prevalent, and we now know it's related to lots of other diseases as well. So we need to do our best to keep this to a minimum because of the savings they can have elsewhere. So this isn't my first visit to the States. My first visit to the States was as a student when I did some research on ortho, and it's the only publication I've ever had. And I was going to say a joke here, but I know now, having run through it before, I haven't got time. But I'll say that this was the bit I was after, was a road trip. And it ended when I got woken up at gunpoint on Sunset Boulevard. But I haven't got time for stories like that. We've got to talk about teeth. Oh, and reflective learning. So this is a video that made following a conversation with tooth decay, the audios treating gum disease in care homes.
So we applied the SDF, and probably a year in, I kept saying, oh my goodness, the plaque is not sticking anymore. Their gums aren't bleeding as much. And it was very interesting to hear Haley say that it does not allow the biofilm to adhere because...
Well, the drop down, that's too much to read. But basically what it was saying is that, does it have an effect on the gums, the silver diamine fluoride? And I've looked it up on Wikipedia, I've looked it up on the Cochrane Review, and there's nothing. And often there's one, if they start to do some research, they have to write it down. But there's nothing there about gingivitis and using SDF. This you're all familiar with, the whole technique. And what was interesting about this is that the woman that developed it, I think she just left the lecture she went to early. But now everybody does it. But they only found out after she retired. I'm retired. No one follows me. Right, so this is in the 80s, and this is how we used to get paid. So I thought I'd put a little bit about the NHS in. So back in the day, it was a really weird system. You basically got paid for what you do. And so if you did 4 fillings, you got paid for 4 fillings. If you did, you got paid for doing an examination. And basically the maximum that the public could pay was £12.50 at that time. And they could have, anything done. But if it got to a certain amount, like you needed a couple of bridges, then you have to ask for something called prior approval before they'd let you. And that's what I did during this sort of period. And at this period also, this happened, when did the Mac get published? In 1984. And, most of us have an iPhone now. And that probably has more to do with keeping prevention than anything. I mean, it also produces problems, but that's a different issue. Anyway, in 2006, the government decided we were just getting paid too much money on that system, so they brought in another system that sort of vaguely worked for a short period. But so the band 1, as you can see there, that's how much you would pay, and that includes checkups and oral hygiene instruction, and I think on scales as well, because polishing, that's not really a dental issue as such. Anyway, band 2 was if you did any fillings or any treatments as such, including root fillings. And the interesting thing about that is if you did 1, you got paid the same and the patient paid the same. If you did 2, the patient still paid the same and you got paid the same. If you did 3, so you can see that if someone comes in who needs a lot of work, you're struggling. And if someone comes in who needs a bridge and dentures, then you're really struggling because the fee you get paid isn't as much as the lab fee. So yes, I don't think this is going to last. No dentist thinks it's going to last. I think it's gone. It's well on its way. So in the 90s, we had a different disease. Oh, what I was going to say was HIV. That was the thing in the 80s as well. And I had applied to do some work on a patient who was unsavory, should we say. He's a lovely guy, but he clearly had some issues. And I'd done a load of surgery on it to clear everything up before I could do any bridge work. And when I rang him, I said, right, I'm ready to do your bridges. And he said, oh, I can't because I've got something, hepatitis. I said, serum hepatitis. He had serum hepatitis. So yeah, we abandoned the treatment. This is another thing, CJD, Coit-Jakob disease, or as it's easier to say, mad cow disease. I'm not sure if you had it in the States, but we had it in the UK. And so what we had to do then was have, everyone was worried about prions and the prions that you get if you did root fillings. Now, we were given dishwashers, or rather we got grants for dishwashers for our instrumentation, or instruments to clean them. Everybody knew dishwashers were a waste of time, just like we all knew that the hepatitis B virus is far more serious than the hepatitis rather than the HIV. Anyway, I did look it up. I did go to the Wellcome Institute and look up how we could get rid of prions. And I looked on a website which was in Canada, and someone had developed a sterilizer with ozone. And I was first on the website, number one. It's the only time it's ever happened. And so there you can see my ozone machine that I had myself in a diagonal dent. That's a great kit. On the radio, that was the most important kit. And but the good thing about that, clearly the dishwashers didn't work. And I do think some people may have got infected, but not the catastrophe that everyone predicted, and certainly not from endo. But anyway, what we did develop was these single-use files and all this fancy equipment, which almost made making a root filling enjoyable. Never made it cost-effective, so nobody really has root fillings on the health service anymore. You just pay $1,000 for a specialist. Oh, and at that time, so what was that one? This is a different one. This is Legionnaire, so we had another one. Legionnaire, so we all had to change our water. Or clean our water pipes. You probably had the same. And so we invested in something called Sterilux, which is hypochlorous acid. And I think it was developed in the Ukraine. Anyway, I was told about it mainly from a patient who was telling me about ozone. And the person that did the research I'd met in 1982 when I just started work as a dentist. And he didn't really like work, but he did this research which came to the fore during COVID. But I asked the professor of periodontology in Bristol if I could use the hypochlorous in my cavitron. And he said, well, I wasn't sure of the percentage. So I asked him about the percentage for hypochlorite. And he said, well, he didn't know. I said, what do you mean you don't know? He says, well, no one's done the research because hypochlorite's too cheap. So I don't know. And but we know now because the percentage of hypochlorite is the same as chlorhexidine, and the results are the same. They both taste foul, but one's a hell of a lot cheaper. The other part about Cochrane was, I do like it, but it's just recently given a really poor review. That's February this year, saying that they don't think it really works. Well, I'm sure there's lots of people in the room to argue about that. Anyway, I've been to the States.
He who needs no nickname, you can just call him Emmett. Mr. Emmett Smith.
So in the UK, we just said David Beckham. And I was one of, I think, 4 dentists from the UK amongst the 5,000 that were there from the States. And that was on, I'd gone there because the crowns I was making using the scanner I had been withdrawn, and they were really good, and I was able to do white crowns on the health service. And unfortunately, they were withdrawn because dentists in America were cementing them incorrectly, and they were failing. It wasn't it wasn't the materials that were failing. It was the treatment by the dentist. But anyway, I got them back and had great success with them. And this is 2018. The government brought out this saying, prevention is better than cure. I mean, who'd have thought that? Anyway, so the big song and dance about it, but as normal, no money. But I did make this video, so I've got lots of videos that you'll see, but actually you won't see. But I made one on prevention. This was really quite early, so it would have been around that time. And I used a thing called Doodly, so please have a look, because it's all about fluoride. And I grew up in an island in Wales where half the island was treated with fluoride and the other one wasn't. And from the state of my teeth, I was in the wrong side. Anyway, so after I started doing things, I tried to promote prevention. I went to the dental show to promote prevention, and I did, as you can see there, business skills workshop. Well, you can see how many people were interested, and that's how much it cost me to give the talk to my brother, and he's not even a dentist. And this is what I was trying to promote, is an app that I'd made, for my patients. So we have a screening process called a BPE. I don't think you have it here. And really, the BPE is screening. But I just changed it slightly because of the slides. I couldn't fit 5 slides on the phone, so I put 6 in. I think you can still just about see it. But the idea was that people I'd send them their BPE as an email. Then they'd personalise the phone themselves, put in their risk factors. It would show them how likely they were to lose their teeth and also get mouth cancer and what they could do about it, and set reminders to check themselves once a month because there were videos in there showing them how to look. And yeah, so this was it. It was about the BPE, and that's something we should be banging on about a lot more, because we now know that the microbiome in the mouth is strongly related to other diseases. So that's what banging the drum about, really. And so this is me, and this is my nurse, Denise, and she was a brilliant nurse. I'd have been an awful nurse. I think she probably had a better chance of being a dentist. And of course, this happened in 2020, and I wasn't really doing any work. I was at home a lot of the time, and it was just really dull. The only thing about it was I'd sold my business, and actually I was earning more money not going into work because I put everybody on a plan. But I wasn't comfortable with it. I think I would say that my values didn't align with the people I'd ended up working for, even though I was in my building. And so that's why I retired. And I retired because I wanted to do this. When I say this, it means travelling. So anyway, I travelled to India with my friend who was 60. I've dragged them all up to Anglesey in North Wales for mine. And at that time, because we weren't, when COVID struck, we were treating people with antibiotics, analgesics and advice, AAA, and seeing people on Zoom. So we had all those other things, crises that happened. But what have we learned from COVID? Well, what we have learned is that, well, the antibiotics seem to work, certainly keep people at bay. So these are the figures from the government about our children and how frequently they were seen to have extractions. But the costs went up. It doubled, and they never went back. And it's a huge amount of money to treat children in hospitals to take out teeth. You have the same problem here. But the reason I left my first practice was I did a general anaesthetic session. We saw 14 children in just over 2 hours. And so on that criteria, I should have been earning that amount of money. I didn't. And again, during COVID, someone asked, who was really interested in prevention, it's not quite the same as myself. George was given a presentation, but he didn't want to do it. He didn't know how to present with his limited skills. He was even older than me, and so I did the presentation. So I did a Zoom presentation for 3 hours. I don't think anyone's ever seen it, but it is there somewhere, as are details about me and something that I'm interested in, 3D printing. So I still go to lectures and conferences, and at this one, there was one done by the Royal College of Surgeons on sustainability. And at the meeting, we were talking about plastic toothbrushes. Should we have plastic or bamboo? And also about the problem, as you can see there, of nitrous oxide being released. Well, none of us have used nitrous oxide. I used it last 30 years ago. I do go to work in my car, and as do the patients. And I said, well, what can we do about reducing that? clearly prevention would work. You wouldn't come as much, but when you come, because you're not like, can you do it over the phone? Arrange stuff over the phone. And I said, so who's it looking into teledentistry? And she said, well, nobody. There's no funding. Why didn't I do it? So these are some of my ideas, and these are all about things you can do with scanners. The last one is for children, is that some of these scanners now have got a caries diagnostic tool. So we could use that in a different manner, and we could get nurses to go to care homes and scan the teeth, and also apply the SDF. And as you can see from this slide here from this chap, Ian Chappell, who's an excellent periodontologist, yeah, and also we can empower the carers if we just give them some instruction on how they should be cleaning teeth, because a lot of them can't even clean their own teeth. I used to see loads of carers, and they couldn't look after themselves, never mind their residents. And we can raise the bar by helping them, which I think most of you do. So the government is kind of aware that they want this flexible commissioning. But it's very half-hearted. They do a lot sort of trying to get dentists to go into the court to listen to a talk on it. But they've only set up 7 places in the whole of the UK for the 60,000 nurses that could possibly improve their skills. And as you can see there, do plaque scores, they can do scanning anyway. Impression taking, quite frankly, they don't need to do that anymore. Apply fluoride, well, that's a varnish. Why can't they apply SDF? And take x-rays. It's nuts. They need to have an indication from a dentist, a prescription to take x-rays, but you don't need a prescription to fly abroad, and that's the same amount of radiation. And so anyone can go on an app that I made, and they could promote themselves and what they did. So you can see there, teledentistry, and this is one of the websites that I made, which will gradually die. And I'm just going to convert everything together. And I've had time to read, and I've read all these different books. So the big white ones, Steve Jobs, as you know, he had a few ideas, and but the others are the top 2. Well, the top 3 are all American, and that's what I've tried to follow. And yeah, even actually the other one's American as well. But it's all about how these very successful businesses, the bottoms are all businesses, actually have one thing in common. They empower their team and they trust them to do the job. And that's what we need. And that's not what's going on in the UK. So anyway, I've made I had to make my own videos when I made an app. And so, I've started playing around with them. And the thing that if you go onto this website, that's, again, I'm going to merge with another one. But if you go on it now, you'll be able to make your own videos with your own, rather use the videos and add your voice to them. And I think that's the best thing, is people listen to your voice and you send them a video either via WhatsApp or an email or whatever. And then, that's how it would work. Oh, and that's where the slides are. So if you go into Denflix, I think it's on the front page, which says, this is how to make a video. And the other one's the Smith test. So this is I think the Smith test works. And this is the website that everything will be on. So I'm shooting through the slides here, as you can see. And these are slides from my old app. That the idea was that it could be customized by the dentist or the nurse or the hygienist, and it customized by the patient or the user. And what we're hoping to do is actually do something a little bit better. And, well, obviously, we're going to improve it. But using this, that we'll have a chat bot on it. So we're trying to get funding for that. Well, get some students to do it. And, so people can talk to the phone, or get their dental problems, and then it will return with advice and maybe appropriate video. And this is the other part I think I mentioned about 3D printing. I think that a nurse can scan in the mouth. She can certainly scan a denture. So 14,000 go missing in the UK. So they could go to a care home, support the carers. We have what's called oral health champions here. And they could also scan the dentures before they get lost. So all this kind of stuff, when I made my app, I was going to use just videos from Facebook. but I was told I had to do my own. I can't remember why now, but anyways, so they're extremely varied. But look on Teeth for Life, and if you type in DHS, there's 10 videos all about how we could improve our health system, or my vision of how we could. And this is the website that, as I speak, is having these other parts all merged to it. And so hopefully you can see that. And ultimately, if I make any money, then I'll do another dental health service app. And that's how it should be. So I'm hoping to learn from you guys all about teledentistry. And I hope you've learned a little bit from me, or at least you've put up with me. So I'm going to time that now. Thanks very much.